Hey everyone, it's Crystal here at the AAFE Training Center, and today I am doing a lip augmentation on this patient. So she's been a patient of mine for a few years now, and I typically do a little bit of maintenance lip filler on her like once a year, I would say. I'm using a medium filler, I would say medium light filler. And you can see I've backfilled it through 0.5 cc Comfortox syringes. This allows me to do the AAFE right angle technique and kind of do those vertical struts of product to really help pick up the lip and give it more show. But I also find because of the 31 gauge needle, it's way more comfortable for patients. And she tolerates it way better than the actual needle that the filler comes with through the normal syringe. I can also control how much I'm pushing. She is a patient that doesn't really want a whole lot of filler in her lip. She just wants like a little zhuzh. So this helps me control the amount of product I'm pushing so that she doesn't get overfilled or that we have to worry about any kind of migration. So you can see I'm not doing as many vertical struts as I would on other patients, just because she doesn't really want all that much. This is just a maintenance appointment for her. Like I said, this is a once a year kind of thing. We just kind of zhuzh up her lip a little bit and she's good for a year. So I'm just adding a little bit to the top and the bottom, giving back some of that hydration to the lip. You can see her skin is like a little red. Her skin just tends to react to the topical anesthetic that we use, but she's definitely tolerating it really nicely. I am doing standard volume, as you can see here, through the Comfortox syringe as well. So just because, we teach to backfill into Comfortox syringes when we're doing the AAFE right angle technique doesn't mean that you can't use these syringes for normal standard volume filling as well. As I said, it just seems to be way more comfortable for the patient. So especially on patients where you're not trying to add a whole lot of volume or you're wanting to be as precise as possible, this is a great option. I think I did about half a syringe in her lips, maybe a little less. And then I did end up using the rest of the syringe elsewhere, just to ensure that, she's getting her money's worth. Once I kind of get filler everywhere, I then use gauze to massage. So you can see I'm just kind of like rubbing over the lip. I'm feeling for any major lumps or bumps, making sure it all feels nice and smooth. And I kind of like milk the lip to ensure that the product is laying nicely. Once I do that, I clean off the patient, I have them sit up nice and tall, and I assess, and then I'm nitpicky, and I'll go back and do a little more in areas that I feel she needed it. So in this instance, I did one poke on her top right, one poke on her bottom left, just to make the lips look as perfect as possible. Always end with a massage. Even though I only did 2 more pokes, I still always massage, and then put our wonderful Comfortox lip care kit on, following that the patient will then take home and continue using over the next couple of weeks to help with the healing of the lip tissue. So that's it. Thank you so much for watching, everyone, and I'll see you in the next one.